One thing that people don't recognize is that worldwide, men and women, as they get older, are at greater and greater risk for suicide. I think it's important and helpful to know that there are just a few things that we associate with suicide in older adulthood that really can be fixed. And when we change those things, when we recognize them and then intervene, that trajectory towards suicide actually can be altered and lives can be saved. The things that pop out and that place older adults at risk are first, depression. And by that I mean clinical depression. Older person with clinical depression typically is going to be sad. They're going to have lost interest in things that commonly interest them. They might be anxious. They might have trouble sleeping. They might have lost their appetite. Feel a lot of somatic symptoms, as we call them, things like pain and stomach upset and that kind of thing. Another is what I call the second D, is debility. It's the idea that even though older people ordinarily almost have one or more chronic illnesses, when that illness or illnesses mount up, when they begin to have an impact on the person's functioning, their ability to maintain independence, and in particular has impacts on things that are personally meaningful. The third D, as I think about it, is disconnectedness. We know that's very important for older people to maintain social contacts and social connections. And so if an older person is withdrawing from or is required to withdraw from social interactions because of physical illness and functional impairment, that disability, or because they're depressed and it's hard to interact with other people, that's an additional risk. The fourth D I think of as access to deadly means. A lot of people don't recognize that that fully among older men, which again, as I said, are by far the highest risk group in the country, over 3/4 of older men who take their own lives do so with a firearm. And of older people over the age of 65 who die of a firearm injury each year, 92% are suicides. So having a firearm in the home, we know, of an older person who has these other Ds going on in their life is at significantly increased risk. Older adulthood is not a time when it's normal to feel depressed. It's not a time when it's normal to feel as if your life has no meaning. And if those things are coming across, that should send up a red flag and indicate a time for some additional evaluation, because these are things that can be changed.